Hi, this is Paul Tunnah. Welcome to another Health Innovators video interview, and really pleased today to be joined by Dr. Francine Kaufman from Senseonics. Fran, welcome and thank you for joining me.
Thank you for having me.
So you've probably seen the format of these discussions. Before we dive into what you're doing now at Senseonics, I'd love to hear a bit more about your background, your career journey, how you've come to your current role. So tell me a bit about your journey.
Well, my journey's been a long one. I'm old and I'm quite proud of it because I feel almost 45 years in the field of diabetes that I've really
Wow.
gained some insight, some knowledge, and certainly some history. So I started as a pediatric endocrinologist at Children's Hospital Los Angeles, which has its faculty position at the University of Southern California. And I was there for almost 35 years doing clinical care. I went from basic research to clinical research to public health research, watched a series of remarkable innovations in the diabetes field, as well as the kind of explosion of type 2 diabetes in children, which hadn't been there when I started my career.
Yeah.
And, just I started my career with animal insulin and urine testing. And kind of look where we are now, so many advances. And at some point, in 2009, I left my full time academic position and was the chief medical officer for 10 years at Medtronic Diabetes to work on the closed loop endeavor. And then about 3.5 years ago, came over to Senseonics to work in a really, I think, incredible, innovative, maybe a little bit disruptive way to do continuous glucose monitoring that really will enable many patients who won't use the transcutaneous systems that we have the opportunity to really use CGM effectively to manage their diabetes.
That's great. And you mentioned in that, long career you've had, you probably know about as much about diabetes as anybody in the world, I'd imagine. And it's one of those big challenges of today, isn't it? It's a mix of genetic factors, but also lifestyle. But you must have seen some pretty big changes during your career in how we manage diabetes. What are the biggest changes you've seen?
Well, when I first started my career, we had not proven that managing glucose, and of course, we had almost no way to manage glucose at that point in time. We hadn't proven that it mattered. That wasn't until the DCCT ended in 1993. So we went quite a long time, or 1992, when all the explosion, and then we got it into practice about a year later. And at that point, we already had some insulin pumps. We got into human insulin, which was a huge innovation. Now the analog insulin. So there's just been advancement after advancement in both the pharma side as well as a technology side. And I watch my patient population. Again, I'm a pediatric endocrinologist, and I still see patients, which is a real privilege as far as I'm concerned. I watched our clinic where we had children already with complications of diabetes essentially become complication free. When I started my career, I told girls that it would be tough, but they, perhaps could have a successful pregnancy. And now it's routine. I've taken care of people who are now, in their 50s and 60s. And it's just been really, really rewarding to watch us turn this chronic self-managed disease into something that I'm not saying it's easy to do day to day, but it is manageable and people live long, productive, healthy lives.
Yeah, and I guess that constant connectivity with the patient just kind of reminds you that it's not just about treating the disease, it's about managing the whole patient's lifestyle and quality of life. And I guess we've seen big steps forwards there, haven't we?
But we absolutely have. My patients are all over the place. I mean, somebody was in Machu Picchu not too long ago, doing all these things that, really help normalize their existence. Lots of things they have to do every day to be able to, you know, dream every dream and have every dream come true.
You talked about obviously a long distinguished career in academia, you've worked on the industry side. Let's talk about Senseonics and what attracted you to your current role and what your focus is now.
Well, I just love their mission. They're very patient focused. They have a great leadership team that I, had known for a while and really admired. And again, the goal is to be a little bit disruptive in the CGM marketplace, to have the first fully implanted long-term CGM system that is truly appreciated by many, many patients. And we're counting on that many, many increasing as we innovate and offer more and more technology advancements. It is truly very, very highly accurate so that they're able to, see that recording, manage the vicissitudes of their glucose values and avoid the short-term severe hypoglycemia and diabetic ketoacidosis complications, as well as certainly mitigate those long-term complications. So I feel, we're very patient focused, very driven to be innovative, to be at the top of diabetes technology, and really able to offer something, quite important in the CGM space.
And for those who are not so familiar with the space, just describe in a bit more detail what a long-term implantable CGM device is and how it works for the patients.
Sure. So it is implanted in a very short office procedure under local anesthesia. So a little shot of lidocaine, a small incision, and then the healthcare provider who we have trained and certified then places the sensor. Maybe takes about 5 minutes from time of skin cut to placing the sensor. It's closed with steri strips. A little bandage is put over for a couple of days, and then over the sensor, which now the skin is healed, so it's a completely closed incision. There's nothing hanging out. There's nothing that can be pulled out because the sensor is fully implanted. Over that, you place a transmitter, and that transmitter actually powers the sensor with near field energy, as well as then gathers the data, mathematically calculates the data, and then sends it to your smartphone, where you can look on your app and you can see every 5 minutes a glucose, an interstitial glucose value. It's measuring in the same space as all the other CGM products. You can see that value. You can see a trend curve. You can see arrows showing you which way the glucose is. It going, going to stay stable? Is it going up? Is it going down? And then that individual can share that data in real time with up to 5 care partners. If it's a young adult with their parents, if it's somebody wants to show it to their spouse, or somebody who's really helping them manage their diabetes, it's a wonderful advantage. And they go about using that value to determine how much insulin do I need, how much glucose do I need, and able to just really manage the diabetes effectively to keep their glucose in this narrow range that we have now all defined.
Yeah. And I guess it gives kind of early warning or warning of kind of high and low blood sugar, does it?
Yeah. So there, and here's where we're truly unique. It's something that many of our patients really, truly adore. I think that is almost the word, is that the transmitter itself, which is just placed on the skin with a very mild silicone-based adhesive, so we have little skin irritation. It vibrates. So if you happen to, run upstairs to get something, or you're going into the kitchen to make a pot of tea, you don't have to have your smartphone in your hand or your receiver in your hand. You will get an alert right on your arm and know that you're high or low, and you can immediately fix it.
Wow, it's like a bit like a phone being on silent mode, but it's buzzing to say there's something happening. And I mean, like a lot of this kind of innovation, it sounds like such a simple, such a smart idea, but it's taken years and years to get to this point. I mean, you're the first to do this, as you described. So what's been the challenges there in getting to this point and having this device?
Well, so our, the company's being a long-term company, was developed first in 1996 as just a science and research entity. And then in 2010 focused mainly just on glucose. And then in 2015 became Senseonics. So first we had the device approved outside the US, and then in the US for the last about three and a half years. And we've just been able to continue to innovate so that we're getting to have a longer lasting sensor. The first one was 90 days. That's where we still are in the US. But outside the US, it's 180-day. We have a innovation on that 180-day product that we're waiting to hear from the FDA as well as the European regulatory authorities. that will give many advantages to the system we have now. We're in research making that 180 days, hopefully soon 365 days, so a year-long sensor, which we know people will really enjoy, being able to have something that lasts a year. You don't have to carry
Sure.
equipment with you. You don't have to come back for the procedure, but once a year. Although, twice a year isn't very much either. And then, its accuracy is being maintained, and just looking at all kinds of other advancements as we go. So
Yeah.
we got a core of engineers who can knock your socks off with their dedication and their, just their knowledge, their inquisitive, research capabilities. And we're just moving along to really meet the needs of the patient.
Yeah. And I guess, alongside the device, you probably needed kind of technology and computing power to get to a certain point where you can kind of manage all this data and manage what happens when you have these warnings as well, don't you?
Well, when you think of it, right? I mean, so it's measuring every 5 minutes. That's, 288 measurements a day.
Right.
So, quite a bit of data. You can imagine what that data set would look like at the end of a year. Of course, it's stored up in the cloud. You can easily pull it down, and we have a data management system. So when I see my patients, I can look at their data. In between, if there's a problem, I can pull it down from the cloud, and look at it and get in touch with them. If first they get in touch with me that they're having a problem, I'm not staring at that data 24/7. I can guarantee you, nor is anyone else. But it's really a very facile system that we've developed to look at the data, look at this time in range, which has become more and more important. Look at the time in hypoglycemia, and really the patients themselves being able to manage a lot more effectively, as well as with their healthcare provider advice.
Yeah. And does that create opportunities for kind of proactive management then as you start to build that data visualization, I guess, for each patient? Does it help them forward plan what they're doing?
Oh, it sure does. I mean, so there's the retrospective. What's my pattern now? What do I need to change to correct, again, either too much hyperglycemia, particularly, let's say, after meals or in the nighttime, or episodes of hypoglycemia. So you can make some active changes in your regimen. Of course, a lot has to do with the behavior of exercise, eating. I mean, we ask people with diabetes to really think of things that the rest of us maybe don't necessarily think about
Sure.
all the time. But to be successful, unfortunately, that's what they have to do. With the alerts and the alarms, with the data management, it makes it so much more data driven. Lots of, as we go forward, AI, lots of things we can expect, machine learning, to really turn that data into actionable insights.
Yeah. And you mentioned before, kind of, you touched on feedback from the patients, and you're still seeing patients. So what kind of comments do you get from them about the device? And do they come to you with a wish list of, well, can you now do this and can you now do that?
Well, I mean, I think what they'd like it all to be done is automatically, and
Yep.
take care of everything and just leave me in the background. That has not yet happened for people with diabetes, but there's a world of researchers working on that. But they'll always need to be monitoring their glucose values, no matter what we come up with. And we believe that a long-term implanted sensor, where in the future you could just query it when you want to, when maybe a cure comes or something like a cure, that will still really have a significant role in the marketplace. And
Yeah.
particularly also for type 2 diabetes, where maybe you don't need all that information all the time, but you want something when you want the information, it's easy to get it. So we are in our innovative path looking at methodologies to get us there when the world of diabetes continues to advance around us.
Yeah.
But what people want is they want to reduce the burden of this management. So having those alarms and alerts, not having to always have my phone with me or my receiver. So that on-body vibratory alert is something they really, really enjoy. We really hear that a lot of them don't like to put the other CGM systems, what they had to put in every 7, 10, or 14 days. Take it out, put it back in, take it out, put it back in. They don't like that. So they like that long-term implanted, even if it's 90 days or 180 days at this point. They like the accuracy. They like the ability to take that transmitter off, and actually the patients call it a naked shower, because when you have diabetes and you've got a pump and another CGM, your shower isn't naked anymore. You've got devices on you while you're in the shower. So they like being able to take that transmitter off, really clean that skin, and some flexibility.
Yeah.
So, we're really listening, and we are, not unique in this, obviously, but we are really patient focused. We really want to hear from our patients. We really work to be able to give them what they really want.
Yeah. Yeah. So it sounds like you've got a lot of data to work with. You've got a lot of good patient feedback. What comes next? Can you sort of share some of what you see as the onward development?
Well, that onward development is to get to a longer duration. So from the hoping to get the 180 in the US and obviously innovate for the 180 system that's outside the US. So this next innovation, this next gen system that's sitting in the two regulatory bodies waiting to be approved. Then we'd like to get to the 365-day sensor, so a year-long sensor. I think we've all learned in COVID, at least for me, sometimes every day seemed like it took forever, but the year went by so fast. I mean,
Yeah.
it's just kind of hard to imagine. And imagine that you don't have to think about changing your CGM for a year. What a burden reduction that could be for the patient. So we're very excited about that, and always excited about for a very very long term sensor like that, and the one we have now, we do require some intermittent calibration. We think with the 365 we can get that maybe to once a week. And then we're going to add a battery, a very, very teeny little battery onto the sensor. It actually doesn't increase the diameter of the sensor significantly, a little bit the length. And then when that battery's in there, you would be able to take that transmitter off and do an intermittent scan with your phone. And then, look at the data. It would backfill some of the data, and you could have, a scanning system that would really give the patient a lot of flexibility. And then when they want to put back on the transmitter, they'll get that every 5 minutes right to the phone as they had before. So we want to
Yeah.
offer really, two different systems. One more that's scanning for the type 2 population and the type 1 population, both of them together with, the flexibility that no other system will be able to allow them to have.
Yeah, yeah. And if you look at what you're doing, it's kind of putting a little bit more control in the hands of the consumer, for want of a better word, which I think is a general trend as we look at medicine and technology coming in. And I think is a good thing, but that can sometimes create some unexpected challenges or opportunities when you're perhaps rebalancing versus very kind of physician-controlled care. Is there anything as you've rolled this out that's kind of surprised you along those lines?
Well, when I started my career, you're supposed to wear a long white coat. Everybody was supposed to
Yes.
call me doctor, and I was in charge, right? You came to my sanctuary called the clinic or the hospital, and I made the decisions for you. Well, maybe that works for, the surgeon who's going to take out something, or maybe even for the oncologist who has to deliver all the care themselves. But diabetes is self-managed. I see them, for 3 or 4 half-hour visits a year, and every minute they've got to think about their diabetes. So it really has to be in their hands. It has to be what they want, what they can use to effectively manage their own diabetes. And I have to, I'm not the pilot, I'm the co-pilot, or maybe I'm even just the, stewardess. I don't know, but it's got to be what they've got to be in charge. I got to give them the knowledge, the tools, the motivation, the rationale, but it's really up to them.
Yeah.
And the better the technology is, the better the pharmacotherapy is, the better they can then take that role on, which is a daunting role. But
Yeah.
when you think about it, we're all managing our health, every day, what we
Exactly.
put in our body, what risks we take, on a motorcycle, or, what risk reduction we do by getting a COVID vaccine. Those are the decisions that are still up to individuals. And, the goal is to give everybody the right motivation, incentives, and education to be able to make the right decisions and
Yeah.
control their health.
Yeah, totally agree. And I've got to ask you along those lines because you've been working in diabetes for many years. And as you say, when you started, it was very much you were kind of in charge, and this is what the patient should do. But we've seen that shift. So, are you seeing a sort of change in training for younger doctors now to help them deal with this new environment where it kind of is much more joint decision making, isn't it?
Yeah, yeah. I mean, I think it's shared decision making, which is something that active listening is important. So we do a lot of how to do that healthcare encounter, a lot of modeling, and belief. I mean, I think what we're facing, at least in the US, is that the social determinants of health are critically important. So, I have to believe in my patients. I have to hear them. I have to meet them where they are, because some of them, they're not all at the same spot. And then, of course, we all have to work from a public health and societal standpoint to, be sure that the water's safe, that there's exercise opportunities, that there's not food deserts. It's really a huge individual healthcare system, public healthcare system, all of society system, if we're really going to get to enable people to be as healthy as they can.
Yeah.
Because some people really struggle depending on where they live. In the US, it's the same everywhere.
Yeah.
To be able to get access and affordability and all the other issues.
Yeah. So as you look forward then in terms of diabetes, and we've made some huge strides as you've outlined, I guess, one endpoint would be some kind of curative therapy for diabetes. But between where we are now and there, I guess there's a number of remaining unmet needs. And do you see particular points where you think if we can just do this, that'll be another big step forward?
Yeah, I mean, I think if we can, really get to effective machine learning and AI, that should help. That somebody could look. Now, it will still take likely having your phone with you all the time, and I'm at this restaurant. I've had this meal before. Here's my starting glucose value. What should I do? And give you some suggestions. And I think, patients may like that, may not like that, where it starts to learn better your overall daily pattern, and knows where you are. I mean, a lot of it may be a little bit of big brother watching, we have to kind of see. But I think the one thing I've learned from diabetes, and what I think Senseonics, and certainly also our partner, Essentia Diabetes Care, really have top of mind is that we have to have great customer service. No matter how far advanced we get, we still have to be responsive to the customer, be able to be there on the other end of a phone when they need it, robust online presence. So if they want to get information, they can get it. And then, to really be there to train and support patients. I don't think that's ever going to go away. And when, we talk about the cure, so when I first started my career, we said the cure was 5 or 10 years away. And
Sure.
that was, in the 1970s. So we didn't quite make that. And I think it's still quite elusive. And of course, my definition of what I think a cure might be might not be the same as what you think a cure might be. But I do think that glucose monitoring, whether it's intermittent with a finger stick or with a long-term implanted sensor that you can query when you want to, I do think that's not going to go away. And the bigger question is, will people without diabetes, maybe the pre-diabetes group, or even all of us, want to know that as kind of a metric along with our weight and our blood pressure, which we can now all do at home? Will we want to know that as a metric to maintain our own health? So we'll have to kind
Yeah.
of see as time goes on.
Yeah, and that's a great point. And we're certainly seeing a much bigger focus on prevention or even kind of early reversal of pre-diabetes signs, which
Right.
is hugely promising. I guess, just to sort of finish with, to bring it back to you, because, you spent many years working in diabetes. You've clearly made an enormous contribution to advancing care for patients in that time. What
Well, thank
keeps
you.
you, what keeps you motivated and passionate about it at this point? What gets you out of bed on a morning?
Oh, well, first of all, I think it's really the patients. When I can't imagine any point in my life when I wouldn't want to continue to see patients and just to hear their stories. To take not too long ago, I had a new onset patient a couple of weeks ago, and to take that child and his family, all the way to, hey, you know what, Fran? we'll call you when we need you. And we'll send you some data in between, but to take them from not knowing what it is and how to manage it all the way to some independence, is just so reaffirming and so exciting. So I think the journeys that patients have are really the motivation.
That's great to hear. Great to hear. Fran, it's been a real pleasure speaking with you. Thank you so much.
Thank you, Paul.